Hey folks, Matt here again with another video where today we're going to be talking about our bag valve masks. And as you can see, I have a couple examples laid out here before us, which I'll take a look at here momentarily. But I just encourage you, if these are not the particular models that you have in your shop, to become familiar with their devices, because there are some slight nuances to each product. And the basic purpose of this video today is just to provide us with an overview of the device and identify some of these basic components of use. So I actually want to start, even before the self-inflating bag itself, I want to start by looking at the masks. And a lot of these devices will become pre-packaged, usually in a bag, and they'll have a mask, and I'm going to hold up one here. This is the PEDS mask that comes in our PEDS bag here, you can see. And it's pretty self-explanatory, just attaches right on the end here for our 15mm adapter. But one thing you'd notice on this mask that it may be different than the adult one, which I'm going to show you in just a moment here. And as you can see, there are a couple of things that may look a little bit different on the adult mask here. First off, it does have these attachments for straps to go around the head, albeit we never really use those. We actually hold this down on our patient's face when we're providing positive pressure ventilation. But the other thing I want to show you here is this valve. Here you actually have the ability to instill or withdraw gas from the mask if you don't have a good seal. Now usually they'll come inflated in the bag when you pull them out, but technically if I were to take a syringe, and I'm just going to do that quickly here, hook this up, and I wasn't getting a good seal with the patient, maybe it was overinflated, I can withdraw air from the mask. Or likewise, if it comes out and it's deflated, especially if it's been in a cold environment, I might be able to just instill a little bit more if I need to. But yeah, it's just a unique feature of this particular mask. So there's that. Let's actually start, I think, kind of backwards and look at the distal end here. And on this one, you're going to notice that I have the oxygen attachment here. It just goes to your wall source of oxygen. And manufacturer recommends about 15 liters per minute. There may be circumstances where you may go higher than that, but generally speaking, 15 liters per minute is recommended for your bag valve mask. This particular model, unlike some of them that you may be used to seeing a self-inflating bag, actually has a corrugated tubing which contains the reservoir and contains the oxygen from which you'll draw from every time you squeeze the bag. So this corrugated tubing is actually our oxygen reservoir in this particular model. And then when you look at the manual resuscitator itself, this is the adult version. And it's important to note that most bag valve masks have the ability to deliver greater than a liter. Now, if we think about how much typically our patients need, if we're giving somewhere between 6 to 8 milliliters per kilogram, imagine if I had a 100 kilogram patient and I was giving them 6 milliliters per kilogram, that would be 600 milliliters for each breath or tidal volume. And if this provides over a liter, then that just tells me that I really don't need to try to instill all the gas in this bag. I only really need to cause enough chest rise and fall that I'm ventilating the patient. And so it's really important, especially in those high stress adrenaline type moments, that we're not over ventilating our patient aggressively, just enough to cause rise and fall of our chest. Now, I also have the PEDS bag out here. Generally speaking, depends on the manufacturer. While the adult may have over a liter, the PEDS can have easily 500 milliliters in its bag. And I don't have one today, but there is an infant one that's generally somewhere in the ballpark of about 250. Again, it depends on the manufacturer. Another unique feature, though, on this pediatric bag, which I'm going to allude to here in just a moment, is that when I am providing pressures, I have this little device here on this model. And this is actually a little, what we call the pop-off valve. And it's designed to, if I reach a certain pressure, to release that pressure so I'm not giving my patient excessive force. You'll see it has this little cap, and when it is down, or in this position as it was found, it was up, it's locked and it can't pop off, which means as I squeeze this hard, it's going to deliver that gas with that pressure behind it to my patient. So it's important that if you have the pop-off valve functional, now if I reach a certain pressure, it's kind of hard to tell, but it's actually blowing off the excess here because the pressure is reaching 40 centimeters of water or greater, and so it releases that pressure so my patient doesn't get trauma from these high pressure volumes we're giving the patient. Okay, so as we were talking about this end of the bag valve mask section here, as you can see, there's the exhalation port, and it also has one on the peds here. And so when my patient, I ventilate them and they passively exhale, the gas is going to come out of here. Well, that's fine, but sometimes if I want to improve oxygenation, I can actually hook up a PEEP valve, and I'll demonstrate that in just a moment here. So here's a PEEP valve, and if you haven't seen one of these before, this will create a little back pressure to keep gas and distend the alveoli to maintain alveolar recruitment and functional residual capacity for my patient. And I can dial this lever down. It's at 5 right now, but I'm going to raise it up here. But I just dial this down, screw this down to how much PEEP I want to give in centimeters of water. And I'm just going to set it at 5 because that's a usual standard setting a lot of times when patients are on the ventilator. But this PEEP valve would just go, take off that exhalation valve, and it would just attach right on here. And now, when the patient expires, it will provide a little bit of pressure, 5 centimeters of water, to try to keep the alveoli open and participating in gas exchange. So giving PEEP along with FiO2 are one of my prime methods for improving oxygenation in my patient. Lastly, as I come the more proximal end here, this is just my 15 millimeter adapter. This is going to either hook to my bag valve mask, or it will hook to my ET tube. And you'll notice that I have the ET tube hooked up to the peds bag and the mask hooked up to the adult, but it doesn't matter whether you're using infant, peds, or adult. They all have a 15 millimeter adapter to connect to your ventilator circuit or your ET tube or your mask. So that's it, folks. That's just a quick overview of these devices. I'll try to put in a little video demonstrating some BVM techniques, and we'll have a chance to practice this more in class. I hope this has helped, and until next time, bye for now. Hey folks, just a quick demonstration of the positioning we talked about and how important it is for a good bag valve mask technique. With my mannequin here, you can see I've ramped them in this position where I have the head. If you actually look at the face, it's about parallel with the floor to put them in this sniffing position. Another common thing we will do is kind of raise the, what we call the external auditory canal, or basically the ear to the sternal knot. So what I'm really looking at is from about here to here by ramping the shoulders as well as the head to put them in the ideal position. This does a couple things, helps displace some of the soft tissue in the oral cavity, but also gets some of the weight off, some of that transthoracic pressure off of the chest wall and the abdomen for which we have to ventilate against. And so positioning can really be a helpful aid to us to perform bag valve mask technique. Now, of course, with the bag valve mask technique, we also talked about using our adjuncts. And so I'm going to demonstrate a few of those right now. Okay, folks, while I have my patient here in the lab, I was just going to do a quick demonstration of what we've already talked about in regards to the NPA and OPA. And the first one I'll take a look at is our nasopharyngeal airway with the NPA. Of course, I want to select one that has the right size, and that's going to be from the nair into the ear. Of course, I've already determined this is an appropriate adjunct for this patient. There's no contraindications. Next, I would select a little lube to put on to facilitate passage without causing any trauma. And then I'm going to insert the bevel towards the septum. Just with gentle pressure, it should be able to slide back in. And let's see if it does it on this mannequin. It does. Great. Now that can be used on a semi-conscious patient, but when we use our oropharyngeal airway, we want an unconscious patient because this will make them gag. So again, I need to measure this from the corner of the mouth to the angle of the jaw. And there's two techniques for this. One is without any device, I can insert this backwards like this, and the reason for this is I'm looking to get around that tongue, and as I insert it just past the hard palate, I'm going to rotate it 180 degrees to let it sit on the teeth. The other technique, which I really like, is just takes a tongue blade, or if you don't have a tongue blade, something I've used quite easily is just your suction catheter. I'll stick my suction catheter in, compress the tongue, and now I can easily slide this in without worrying about causing any soft tissue injury by rotating that in the mouth. And there we go, we have it. And now I can perform bag valve mask ventilation. That's it, folks. Hope this video has been helpful. Until next time, bye for now. Okay, folks, here we are at the end of the video, and we're just going to do a quick demonstration of the one-person and two-person bag valve mask technique we talked about earlier in the video. As you can see, I've already got the patient kind of prepped here. You can see some towels under the head, so I have the patient in the sniffing position. We also have our airway adjuncts, a nasopharyngeal airway as well as an oropharyngeal airway, and to help us displace some of that soft tissue so we can perform adequate bag valve mask technique. I'm going to have a colleague of mine go ahead and demonstrate the one-person technique, and Samantha, if you'll do that for me now. You notice how she makes a good seal over the bridge of the nose and over the chin there. She's using the EC clamp technique we talked a little bit about earlier. And she's just going to give a couple gentle squeezes of the bag. Now in this particular mannequin, the chest does not rise or fall, but she's given just enough tidal volume that we would see rise and fall, not excessive ventilation. And that's great. And now I'm going to demonstrate the two-person technique here. So here you go, folks. Here's the thenar technique we were talking about earlier, where I put my thumbs down on the mask itself. I'm going to take all my other fingers around the mandible, and I'm actually lifting like a jaw thrust up into the mask. Not pushing down, but lifting up into the mask. And then here, Samantha can go ahead and give a couple of good squeezes with the bag. Great. And having two-person technique really facilitates better airway control and is actually recommended over the one-person technique for bag valve mask technique. So there you have it, folks. Just a quick demonstration of what we talked about earlier. Hope this video has helped. Until next time, bye for now.